Hey guys, it's Dave from Dave's Pharmacy. Talking to you tonight about a serious topic, but a sensitive topic: chronic constipation. Constipation can happen to anybody, any age. I have parents bring in little ones that are constipated, just can't go, makes them absolutely miserable. On up to the 99 plus that just can't have a good regular bowel movement. Things are backed up, they're upset, the toxins in their body won't release, so it is literally making their body sick. I'm going to give you some tips throughout each age group to kind of help you out. When you're looking at little ones, generally what is happening there is they may not be getting enough fluid. It's important, even in little ones, to try and keep them as well hydrated as you can. And there's nothing wrong with trying to get some water into little ones. That will help the bowel movement to actually pass through. An old tip that is still a good tip for little ones is just a little Caro syrup. You want to watch out if you know your child's diabetic, because that is an issue and you want to talk to their provider. But generally, a teaspoonful of Caro syrup will help get their bowels going. Again, hydration is the best thing, and movement. If they're old enough that they're walking around, or at least trying to walk around, crawl around, the more that they move, the more that their bowels will be likely to move as well. So that's one thing to look at. If you continue to have issues, talk to your pediatrician or provider, because you can do things like Fiberlax or glycerin suppositories as well. But get your dosage from a pharmacist or your provider on that, because it is age and weight specific on the Fiberlax. As we get older, there are definitely, again, times where you can become constipated. A lot of times it's something as simple as drinking water. You've heard me preach about it time and time again. At least trying to drink at least 2 liters of water a day will help keep your bowels moving, and you won't be constipated. If you're not drinking water, or if you're drinking tea, pop, coffee, alcohol instead of water, all of those can dehydrate your body and thereby make you constipated. So really push the water. Juices are okay. Apple juice is a good thing. Prune juice is a good thing. And prune juice and apple juice you can use in little ones as well. Generally, if you give them about a cup of that, it will get their bowels moving. As adults, if you drink an 8-ounce glass of either prune juice or apple juice, generally that will do the trick. The other thing that happens as we get older, guess what? We sit at the office all day. You're sitting down, working on the computer, maybe on the phone, or we're at home. We're sitting in our chair, watching TV, binge watching Netflix. We all do that. You need to get up and move around. The more you move, the more your bowels will move. That's why it's so important post-surgery. One of the first things when I was in the hospital, you get that patient as soon as they can moving. Getting up and moving, walking the halls is great. If you can't walk the halls, you can do things swinging your arms. A sit-still bicycle where you can just pedal, where your legs are moving all the time. Any movement will help to keep those bowels moving. Something else that I always recommend, especially to patients on antibiotics, and that is a good probiotic. There are several choices out there. I recommend Florigen myself, and I personally take Florigen. But there's also Lactinex. There's also Pure Vitamin, also makes a very good probiotic. It's definitely a good idea for those that are on antibiotics, but I take one every day. I'm not on antibiotics. It just helps keep your gut flora, the good stuff in your gut, healthy. Because when your gut health is not what it should be, you're going to have toxins, you're going to be prone to getting sick. all different kinds of illnesses and major illnesses are tied to your gut health. So you want to keep your gut healthy. You want to make sure you're having regular bowel movements to clear those toxins out of your system. So hydration, movement, two easy, cheap fixes. The other thing that you can do, and there's nothing wrong with it, you can get a stool softener, a natural stool softener such as Senna. It's over the counter. You can take 1 to 2 a day. No major drug interactions with that. It also comes as Senna S or Senna Plus. And in that is not just a stool softener, but a laxative as well. And like I said, you can take 1 to 2 a day. You can take up to 4 a day, but I don't want you to jump on the 4 train and then spend an hour in the bathroom. Start with 1 to 2. See if that will do the trick. Hopefully it will. You can also use something like milk of magnesia, 30 mils every day or every other day as needed. You don't want your gut to become reliant on a laxative like that. One of the questions that has come up recently, because there was a national recall of magnesium citrate. Magnesium citrate is a stimulant laxative that you get results pretty doggone quick. Generally, I recommend a half a bottle in a half hour. If you don't see results, take the other half. What's really bad about it is a lot of colonoscopy preparations used mag citrate to get you ready for your colonoscopy prep, or actually as the colonoscopy prep to get you all cleared out. So what do you do if you were taking mag citrate, now it's not available? Well, one of the things that you can do is Fiberlax. It's not a stimulant laxative, but you can take Fiberlax, a capful, once a day in juice or water on a regular basis. You can do that every day or as needed. As long as you stay well hydrated, that should help keep you moving. The other thing you can do, I don't really recommend it as much, but there is the bisacodyl or Dulcolax tablets and suppositories. You can take 1 to 2 of those once a day. Again, best as needed, because you want your gut to actually work on its own to help clear that out. If you continue to have an issue, it's always a good idea to talk to your provider, because there can be some major things that are going on. If you have a blockage, you don't want to continue to pump yourself full of laxatives trying to go to the bathroom when the blockage is the main cause. You want the root cause to be found out, and the best way to do that is speaking to your provider. You may need to have an x-ray to see if there's something going on where they have to manually go in and get things cleared out. The other thing that you can do on a regular basis, if you're not generally constipated, it only happens every once in a while, you can take something like Fiberlax, which comes in tablets as well as powder. Metamucil, that's one that's been also hard to get in the powder form, but you can take that on a daily basis. It will help to bind the toxins and pass those out daily in your stool. The other thing good about that is it can lower your triglycerides and cholesterol if used on a regular basis. So that's not a bad idea to do on a daily basis, especially after you get the age of 50. Now, there are some people that have brought up the question and asked, and this is absolutely the case with tricyclic antidepressants. So you're looking at amitriptyline, nortriptyline, drugs ending in the tylines. You want to watch out for their tricyclic antidepressants. One of the major things that they can do is dry you out with what's called anticholinergic effects. That's where the dizziness, the drowsiness, the dry mouth, the dry nose, the dry eyes all come from. Guess what? It also dries out your intestines, which makes it hard to go to the bathroom. So again, stay hydrated, but if you continually see a problem with constipation on that and you're on one of those medications, talk to your provider. There may be a better alternative for you as far as an antidepressant or as far as something for nerve pain, because they're also used for that. The other thing that we see a lot of is opioid-induced constipation, which is a chronic issue. If you're on a pain medication, short-term or long-term, if you happen to be on one like OxyContin that you have to be on for your pain on a daily basis, again, I go back to the first two things, hydration and movement. Cannot overestimate those. But there are drugs out there now that can help you with the opioid-induced constipation. One of them, in fact, just went generic. It's Amitiza. It's in generic form now, so where it used to be so high priced, it's still a high priced generic, but hopefully that will slowly start to drop over the next couple of months. Movantik is another one, and there are two other options. But remember, those are high priced options. You do need a prescription. You do need to talk to your provider. Your insurance may not cover it. So again, if you're having issue with constipation, talk to your provider, but keep yourself moving, get yourself hydrated, and let's go from there.